Hello and welcome to Spine Camp. I am Erin Masters, registered nurse, clinical coordinator, and educator at Spartanburg Regional Healthcare System. As a spine surgery patient at Pelham Medical Center, you are now a member of our Spine Camp program. Thank you for choosing us for your surgical care. Our team of experts are here to help you receive the best medical treatment available, and we will be with you every step of the way. This video, Preparing for Surgery, is the first in a 3-part series that will walk you through every step of your spine surgery journey, including how to prepare, what to expect, and what you can do to ensure the best possible recovery. Pelham Medical Center Spine Camp is a collaborative effort that starts with you and includes your orthopedic spine surgeon, orthopedic coordinator, hospital staff, and your care partner. Our Spine Camp is a comprehensive program that was developed especially for you to ensure that you have all the knowledge you need before, during, and after surgery, because we want you to be involved in all stages of your surgical journey. Every patient in our spine program will experience our team approach to patient care. As you can see, your spine team will consist of many healthcare professionals dedicated to helping you through your surgery and recovery. The information presented in this video series can also be found in your Spine Surgery Patient Guide. This important guide serves as a comprehensive resource of information for you to use from the beginning of your spine surgery journey and beyond, and we encourage you to read it in its entirety. In this video, we will present an overview of the anatomy of your spine, as well as information about some of the most common spine surgeries. You will learn the 4 phases of surgery, as well as what an important role you will play in your own spine surgery journey. We will show you what you can do in the weeks and days before your surgery in order to be as prepared as possible. We will also discuss how important pre-surgery preparation is to your post-surgery recovery in programs known as ERAS and PRE-HABILITATION. You might wonder why it is important for you to learn more about your spine. We give you this information because the more you know about how your spine functions, the better you can protect it before and after surgery. Humans are born with 33 separate vertebral bones. However, by adulthood, we typically have 24 due to the fusion of the vertebrae in the sacrum. A healthy spine shelters the spinal cord and supports the body while allowing it to move freely. The spine consists of 5 sections. The cervical area of your spine is at the back of your neck and has 7 vertebral bones. We refer to them in numerical order C1 through C7. The C stands for cervical. The thoracic area of your spine is made of 12 vertebral bones located at the back of the chest and mid-back region. They are referred to as T1 through T12. Next is the lumbar area, which has 5 bones referred to as L1 through L5. Just past the lumbar area is the sacrum with 5 joined bones, and then you have the coccyx or tailbone, which consists of 4 small bones that are joined together. Now let's take a closer look at the individual bones of the spine, known as vertebral bones or vertebrae. The small round area in the front is called the vertebral body. In the back is a bony ring from which protrusions extend and arches and canals are formed. This area serves several purposes. When vertebral bones are assembled together, it stabilizes the spine as a column and provides a tunnel for the spinal cord to pass through. Nerves exit the spinal cord and branch out to all areas of the body through this space, and connective tissues and muscles of the back attach to it as well. Another important section of a vertebral bone is called the lamina. The lamina is a thick arched bone comprising the back part of the spinal canal. The bony tip extending from the lamina is called the spinous process, and it is the part of the spine you can feel when you touch your back. A cushion known as the intervertebral disc sits on the vertebral body between each of the vertebrae. This disc provides shock absorption during motion, protecting the vertebrae and spinal cord from injury or trauma. With age, these discs can lose fluid, making them less flexible and more compressed. They can also develop tiny tears in the outer layer, which can cause pain. Tears in the outer layer of the disc can also allow the jelly-like inner layer to bulge out, causing pressure on the spinal cord and/or the nerves. This is known as a herniated disc. Some people may be surprised to learn that spine surgery is not always done through the back part of the body. In fact, spine surgery can be done from the front, which is known as the anterior area, from the side or lateral area, or from the back, which is called the posterior area. Sometimes a combination of approaches are used. Your surgeon will discuss the best option for your surgery with you. Some of the most common spine surgeries are laminectomy, discectomy, disc replacement, fusion, and bone graft. The next few slides will give a brief overview of each of these surgeries. The first surgery we will look at is laminectomy. A laminectomy involves removing all or a portion of the arched section of the vertebral bone we saw in a previous slide known as the lamina. This creates space and enlarges the spinal canal to relieve pressure on the spinal cord or nerves. Laminectomy may also be done to treat a disc problem or remove a tumor from the spine. For instance, one common reason for having a laminectomy is a herniated disc. A discectomy is the removal of part or all of an abnormal disc between two vertebrae. If the entire disc is removed, a spacer is inserted to realign the height in this space. This type of spine surgery may be recommended if physical therapy or medications fail to relieve leg or back pain, or if you have signs of nerve damage, such as weakness or loss of feeling in your legs. Disc replacement surgery is also called arthroplasty, and it removes an abnormal disc and replaces with a metallic motion-sparing device that tries to mimic the natural motion of the spine and preserve disc height. Spinal fusion surgery stabilizes the spine by fusing together two or more vertebrae and often involves the use of screws and rods. To stimulate bone fusion, your surgeon may use additional bone for a procedure known as a bone graft. Fusion is done for a variety of spine conditions, including instability, significant degeneration, or scoliosis. As we just mentioned, bone grafting is a procedure used in spinal fusion surgery to help stimulate the growth of new bone. The bone that will be used in the procedure can be bone spurs that are removed from your spine and reused, or a piece of bone can be taken from your hip bone. Bone for grafts can also come from a bone bank, and bone-forming proteins can also be used in this procedure. The graft is placed on the sides of two joining vertebrae, and over time, the bones fuse together, creating a solid, stable area. No matter what type of spine surgery you are having, Pelham Medical Center has state-of-the-art surgical technology, and you will receive expert care from your team of specialists who are dedicated to making your surgery as successful and stress-free as possible. There are 4 phases in your spine surgery journey. In each phase, there are a variety of important things you will need to know and do. The preparation phase begins when your surgery is scheduled. You will move into the preoperative phase a few days before surgery. When you arrive at the hospital, you begin the perioperative phase, and the post-surgical recovery phase begins after your surgery is complete. As we said, this video is part 1 in a 3-part series, designed to guide you through the 4 phases of your spine surgery experience. In the remainder of this presentation, we will familiarize you with the first 2 phases, the preparation phase and the preoperative phase. So what is your role in your spine surgery journey? It goes without saying that you are the star of this show. We want you to be as knowledgeable and prepared as possible so you feel confident and comfortable about each step of the process. If you have not already done so, now is the time to identify a care partner. A care partner is a family member or friend you can count on to be with you through your entire surgical journey. It should be someone who can commit to help with transportation to and from the hospital, as well as to your physician and therapy appointments. They should also be prepared to help for a while with meal preparation and activities of daily living. Phase 1 of your spine surgery journey is called the preparation phase, and it begins several weeks before your surgery date. As soon as possible, you will need to let the appropriate people know about your upcoming surgery. If you are employed, notify your employer to arrange for time off. Also, contact your insurance company to confirm how much of the cost they will cover and set up a payment plan with the hospital for your portion of the bill. Plan ahead and schedule any necessary appointments that need to be completed before your surgery. Include medical and dental appointments, but don't forget about routine items like getting a haircut, stocking up on groceries, or taking the dog to the groomer. If you haven't already done so, this is the perfect time to set up advanced directives for healthcare. Advanced directives is a general term that applies to 2 types of legal documents, a living will and a medical power of attorney. Creating a living will to communicate your healthcare wishes for the future is a gift to both you and those you love. A medical POA or power of attorney involves designating someone to make healthcare decisions on your behalf if for any reason you are not able to. Blank copies of these documents can be located on the Spartanburg Regional Healthcare System website at spartanburgregional.com. We also have an advanced care planning department to help you if you have any questions or want additional information. You will need to bring copies of your advanced directives to your pre-admission testing appointment. It is important to go ahead and prepare your home so you will have a safe environment after surgery. Inside your home, you will need to remove all throw rugs. Pathways should be well lit and free of cords and trip hazards. If necessary, install handrails on stairs you will use the most. You will need a chair with arms to assist with easing yourself into standing position. In the kitchen, place frequently used items at waist level for easy access. In the bathroom, some patients prefer a higher toilet during their recovery period. If possible, establish a bed and bathroom you can use on the main level of your home. If you have pets, you should refrain from letting them sleep in your bed until the surgical incision is healed, and don't allow pets to jump on you as this can lead to falls. You will need someone to help with laundry the first few weeks after surgery. Nutrition is very important for healing, so plan ahead for healthy, nutritious meals. You can pre-cook and freeze food, schedule food delivery services, or ask friends and family for help with meals after surgery. Meals with lean protein are helpful for healing. Enhanced Recovery After Surgery, or ERAS, is a modern treatment program for surgical patients that is based on the best available medical science. Enhanced recovery is sometimes referred to as rapid or accelerated recovery, and some aspects of ERAS care might be different from any previous operations you may have had. One key component of enhanced recovery is to ensure that patients are as healthy and prepared as possible before receiving treatment. Having an operation can be both physically and emotionally stressful. Enhanced recovery programs encompass guidelines for the best patient care before, during, and after your surgery and are designed to reduce stress and help you return to an active lifestyle as soon as possible. One part of the ERAS program involves optimizing nutrition to help your body heal. This should begin in the preparation phase and continue throughout your entire spine surgery process. Protein is a key nutrient for muscle and bone building, and it also benefits the immune system. The amino acids in protein assist with wound healing and tissue regeneration, as well as helping with strength and energy following surgery. Eating protein-rich food is the best way to increase protein levels, but nutrition supplements can help as well. Protein needs are unique to each individual, but as a general rule, the body needs 1.5 grams of protein for every kilogram of body weight post-surgery. Constipation can be an unwanted side effect of any surgery, so increasing fiber and water intake starting now is beneficial. The American Heart Association recommends getting 25 to 30 grams of fiber each day by eating a variety of foods. This includes fruits, beans and vegetables, as well as whole wheat varieties of bread, cereal, and pasta. Fiber needs water to do its job, so as you increase your fiber intake, it is also important to increase fluids. To ensure that you are drinking enough water, set daily goals, keep a stock of water bottles handy for when you're on the go, and get into the habit of drinking a glass of water before each meal, when you wake up, and before you go to bed. Hydrating is always important, but it is especially important after surgery. Water increases blood flow to the incision site and can help prevent the formation of blood clots. Stool softeners such as Senokot or Colace are also helpful for combating constipation if needed after your surgery. Adding protein, fiber, and water to your diet is an important part of preparing for enhanced recovery, but eliminating unhealthy habits is just as important. Research has shown that diets high in sugar and saturated fat can increase inflammation. We want the opposite when healing from surgery, so it is important to start now limiting your consumption of sugary foods and beverages, caffeine, and alcohol. One of the best ways to ensure proper nutrition after surgery is to prepare and freeze healthy meals in advance. This will make post-surgery meals easy and convenient and give your healing body the benefit of proper nutrition. If you have been waiting for the right time to quit smoking, this is it. If you smoke, you probably already know that smoking is bad for your overall health, but it can complicate surgery as well. Smokers typically require higher doses of anesthesia, take longer to heal, and have a higher rate of bone graft failure. Smokers also have a greater risk of having a heart attack after surgery than non-smokers. Kicking a habit like smoking can be very hard, but the South Carolina Quit for Keeps program has helped millions of people, and it can help you too. Get started today for one-on-one support to beat urges, manage withdrawals, and switch up your habits so you can enjoy life tobacco-free. Even if you have tried to quit before with no success, we encourage you to try again. It takes a couple of weeks for your lungs and immune system to start to function properly after you quit smoking, so the sooner you quit, the better. Most people have heard of doing physical therapy after surgery for rehabilitation, but not everyone is familiar with the concept of prehabilitation. Prehabilitation involves exercising before surgery to make you stronger, so there is less weakness to correct after surgery. Prehabilitation exercises have been proven to help patients feel stronger and better prepared for surgery and recovery. It is understandable that your activity level and strength may have decreased over time due to back pain and mobility issues, but remind yourself that the stronger you are before surgery, the easier recovery will be after surgery. Do your best to be as active as you can between now and your surgery date by walking, sitting up instead of lying down, and doing the recommended exercises found in your spine surgery patient guide. Phase 2 is the preoperative phase, and it begins a few days before your surgery. The preoperative phase will begin with your pre-admission testing appointment, which will be scheduled by your orthopedic spine surgeon's office. Your appointment will take place at Pelham Medical Center on the first floor. At this appointment, you will meet with a registered nurse who will gather information about your health history, as well as any medications or supplements you are taking. If additional lab work is needed, it will be performed at this time. The nurse will also review any paperwork or test results, and they will provide important instructions for you to follow in the days leading up to your surgery. The items and instructions you receive at your pre-admission appointment are important parts of the ERAS program. You will start using several items to help prevent infection 2 days before your surgery. CHG bath wipes are used each night after bathing. Peridex is an oral mouth rinse that helps to eliminate bacteria, and mupirocin ointment is applied inside both nostrils to help eliminate bacteria as well. Depending on your doctor, you may receive 2 pre-surgery nutrition drinks to drink the night before your surgery and 1 for the next morning before coming to the hospital. As your surgery date gets closer, be sure to monitor your health and call us if you get sick. There are several conditions that can delay surgery, so it is important for us to know if you are having any issues. Some prescription drugs and supplements need to be discontinued several days before surgery, so make sure to discuss this with your surgeon in advance. Also, please discuss all supplements and herbs that you are taking with your physician. As you pack a bag for your hospital stay, please remember to leave all valuable items at home. Some items that you will want to pack include your medication list. Please include their dosage and how often you take them. Do not bring your medication bottles. Books, magazines, or other reading material. Your glasses, dentures, hearing aids, and their cases. Walking shoes or sneakers with non-skid soles. Copies of your power of attorney or advance directives documents. Loose-fitting clothes if you do not wish to wear a hospital gown. Personal toiletries if desired, and your spine surgery patient guide. The day before your surgery, do not eat any solid food after midnight and do not shave the area of your body where your surgery will take place. This will be done by the surgical staff if necessary. Please do make sure you have removed all jewelry, rings, body piercings, and nail polish. Also, if ordered by your doctor, drink 2 pre-surgery nutrition drinks the night before surgery and 1 the next morning before coming to the hospital. Do feel free to brush your teeth on the morning of your surgery. Most importantly, we want you to take a deep breath, try to relax, and rest assured that our team of experts are committed to giving you the best medical treatment available and to making your hospital stay and recovery as comfortable as possible. Contact your orthopedic spine surgeon's office if you have any questions or concerns.